Good afternoon, and thank you for joining us this afternoon. I'm Tracy Truelove, one of the public information officers from the incident management team working on the COVID response. Today we're calling this a community presentation because we really don't have our normal partners here today to provide a subject matter expert look into what's happening, but what I do want to share with you is an update. And then what we're going to roll to is a presentation from Charlie Spickert, who's one of our epidemiologists who's been doing some modeling in our community. And he did a presentation on Monday to the Board of Health. And after I get done with my update, we're going to roll that presentation to share with you. And then what we plan to do is be back next week. We'll get the date and the time set for another community meeting where, moving into the next phase of the public health order, we want to be sure we're sharing as much information as possible with you. But let's move to that. So the Pitkin County Public Health Order is in place until May 9th. And the reason we've chosen the gradual opening to increase our likelihood is so that we don't backtrack into more of a stringent suppression strategy. That's a lot to say. And as a reminder about the current public health order, what that means is that it's still at stay at home. Group sizes are still 5 or less. Social distancing is required. Essential trips only to the places you need to go, like the pharmacy or the grocery store. No visitors. Non-resident homeowners should self-quarantine upon arrival. So all those things are still in place. And again, essential businesses only are what are currently open. And let's talk about essential businesses, though. You've seen a lot of activity happening around town. And what that is that essential business list has increased to include landscaping, property management, bike repair, office supply, and golf courses. If you're a golfer, you're pretty excited about that. Also, the approved construction projects are permitted with social distancing protocols in place and a safety plan that would have been provided to us through the website. And just a little bit of stats and data for you on that. As of yesterday, there have been over 300 construction sites approved within Pitkin County to get back to work. So part of that, though, further emphasizes the importance of why we're waiting until May 9th for where our order sits now. And that is so that we have time to track the spread of the virus during the first steps of what is lifting the suppression strategy. So there's every likelihood in talking with our public health experts that once we've lifted some of the suppression, we're going to see the cases rise. And we know you haven't seen a lot of cases here in Pitkin County, and that's because you all have been doing a tremendous job with the stay-at-home order. So on May 9th also, we will move to the next phase, which will be closely aligned with the safer-at-home order that the state has out. But there, however, will be some local amendments made to that safer-at-home order. Another important thing, if you missed us last week, is last Friday we started a much more widespread PCR testing strategy with our partners at Aspen Valley Hospital. And just to remind folks, that testing is available to anyone who is experiencing symptoms. And what we'd like you to do, though, is go be referred to that testing facility by your doctor. And if you do not have a primary care physician, then Aspen Valley Hospital wants you to be calling them, and they'll put you through their clinic to get that recommendation to get tested. And what I can share with you right now is that we're seeing actually a pretty low number of people that are symptomatic that are going out to Aspen Valley Hospital to be tested. And tomorrow, the hospital is sending out a lot more detail and data around those numbers. Another thing that we have seen happen in the course of this last week, and I've got mine on, thank you, my darling 16-year-old who is now doing home ec at home because I can't do her math homework. We are on to face coverings or masks, and they're being strongly encouraged throughout Pitkin County, and they're required within the city of Aspen. And what I would encourage you to do is please visit the City of Aspen website where they have a really informative FAQ on their front page of our website that talks about the mask order and what that looks like. So one thing I do want to move to real quickly is that we do have a situational dashboard that we share out on our website daily. And what I would share with you is from yesterday what the numbers for our COVID response are running. So current Aspen Valley Hospital patients known or under investigation for COVID-19 as of yesterday was 1. Total Aspen Valley Hospital patients admitted and or transferred and tested positive for COVID-19, and that's in the course of this response has been 12. Hospitalized COVID-19 patients in Colorado is 2,621. On the Aspen to Parachute hotline calls yesterday was 21 calls. On the Pitkin self-report individual with symptoms, our symptom tracking tool. We've had 445 people participate in that. Pitkin confirmed positive test results were 48, and we know that that's from the testing that we started early in the response, but then we quickly moved to suppression, so we recognize that number is low. Colorado confirmed positive cases is 14,758. Pitkin County COVID-19 related deaths, there have been 2. Colorado COVID-19 related deaths, there have been 766. Those are pretty sobering numbers that we get into the incident command each day, and we do try to share that out as information with you. So that's really my update, and then I'll come back at the end of Charlie's presentation to provide you just a little bit more information about how to stay in the loop and stay connected with the information that we have out there. So I'm going to have our team here roll it to the epidemiological presentation. Thank you.
And just in terms of background, I got into public health about the late 70s. I have a master's in public health and a master's in microbiology, both with an infectious disease and epidemiology track. A lot of the work I did early on was on Rocky Mountain spotted fever, but it was an interesting project because it was more endemic on Cape Cod in Massachusetts than it was here in the Rocky Mountains. So it was fun to spend time there. I did a lot in medical education over the years throughout my career, and then ended up here lately. Moved to the Valley 8 years ago, so I'm a relative newcomer compared to many of you. And my other company that I'm involved with, I do a lot of consulting for small businesses. So I'm very tuned in right now to the pain that they're feeling with a lot of the shutdown and in response to this virus. So my task today is to kind of walk you through Pitkin County's criteria and supporting data for moving into our next phases of response to COVID-19. And I wanted to start off with a brief review of why suppression strategies work, and then we'll move into the evolving criteria and supporting data. Just in terms of a quick comment on modeling and data analysis, a lot of the data that we're looking at, we'll have actual data to support our decision-making, but modeling is used to support decision-making when we're uncertain of the data, or when we don't even have data in certain areas. So the models are idealized situations. One of the more intellectual questions in microbiology is, are viruses alive? If you want some interesting reading, try Googling that and looking at the arguments on both sides. The SARS coronavirus 2 particle has a diameter of about 120 nanometers with a strand of RNA surrounded by protein and lipid layers. To give you an idea of the size, there are 25,400,000 nanometers in an inch. So if you divide that by 120 nanometers, if you put viral particles side by side, there are 212,000 viral particles in 1 inch. So they're kind of tiny little guys. And that has repercussions when you talk about face masks and things like that, and filtering out those viral particles. If a viral particle was sitting on the desk in front of you and you did nothing, it would just desiccate and fall apart eventually. It cannot reproduce on its own. Its lipid coat is key because it makes it, if you run your hand over a surface, it's more likely to adhere to your fingers or your hand than it is to the surface of a countertop or something like that. So that's why washing your hands and wiping down surfaces is so important. And unless you pick it up and actually introduce it into your body, touch your eye or your mouth, it cannot reproduce on its own. It has to be in a host cell. So that's why not touching your face is so important. And of course, it can be inhaled in certain instances. such as someone coughing or sneezing in your face, which is why wearing masks and social distancing is so important. And finally, if you picture a map of Pitkin County and put a dot everybody who's appropriately isolating at home, and then the next morning put those dots into motion, they end up congregating in certain areas, certain nodes. And that might be City Market, the post office, Whole Foods, pharmacies, places like that, which is areas where viral transmission can happen, which is why our stay-at-home orders have been so important in preventing viral transmission. So all of these strategies together are aimed at interrupting viral transmission. And as epidemiologists, we look at a reproducibility number called R0 of various pathogens. And to give you an idea, the R0 of influenza is about 1.1 to 1.4, which differs from like the measles virus, which is 12 to 18. So you can see how a measles outbreak could really expand very quickly. Our studies have shown that the R0 of the SARS coronavirus 2 is between 2.0 and 2.5. So the chart here, it kind of illustrates one infection can lead to 2, which leads to 4, 8, 16. So in just 4 generations, you can go from 1 to 16 infections. If we can reduce that R0 number to 1 or less than 1, then it goes from 1 person to 1 person to 1 person to 1 person. And by the 4th generation, you still only have 1 infection. Next slide. So that in the way of background, the first criteria for easing suppression strategies is a decrease in cases over at least the last 14 days. So we can look at, if we had PCR testing that on everybody, we can look at how our cases are progressing. But in our case, especially looking retrospectively, we have to look at proxy measurements like new cases in healthcare workers and hospital admissions. But going forward, we're focusing on PCR testing for everyone that's symptomatic through AVH and our primary care physicians. So we do expect to see reported cases rise because of that, just because we're actually doing the testing. One of our hedges in looking at that data is going to be continuing to look at our community symptom tracker. So we could actually get information on what's happening at the community level, just in reporting any types of influenza-like symptoms. We'll also be monitoring AVH and VVH COVID hospital admissions. And we'll review and compare testing and symptom tracking from adjacent counties and the state. And then finally, we're going to try and put in place some tracking by occupation so that as we open up various segments of our community, we can look at those cases within those specific occupations. Next slide. So here's a picture of our actual community tracker data. And if you look at it, our peak in onset of influenza-like illnesses was in mid-March. Because we didn't have a lot of confirmed testing for cases, you could see that next line right below it is the confirmed cases, but it kind of parallels, you know, what the community tracker showed. And then the bottom line adds probable cases just based on the history of the patient. So we're collecting this information on an ongoing basis, and we'll be able to see any spike in the data. And we're also collecting similar data from Garfield County and the Roaring Fork section of Eagle County so that we can kind of continue to monitor people's movements through those areas as well. Next slide. So this is data actually of AVH hospital admissions. And over the course of time, even since March 9th, they've been averaging less than 1 per day. 2 were transferred to a higher level of care at a lower elevation from the ICU, and 2 were transferred from the emergency department. So we're there's no real big spike. The range of these is 1, 2, and 3 per day. We've never had really challenged our ABH's capacity. And we're also watching this kind of data from Valley View and other Colorado hospitals as well. So retrospectively, we have our symptom tracker and hospital admission data, which tells us that we flattened the curve, and going forward, we will actually have PCR test results for symptomatic patients. Next slide. The second criteria is to look at our health system capacity, and then it's ready to handle any surge in cases, and current hospitalizations are stable. And right now, we've never, like I said, we've never really challenged ABH's capacity to any degree, but in advance of a potential surge, they've done a lot of great planning, which I think is a testament to our IMT, Dave Ressler and his team, and to cooperation of all the regional hospitals to put in place plans to handle any kind of surge that might come forward. The third criteria is that testing can be performed on all patients. There we go. So where do we stand there? ABH is now focused on providing community testing, PCR testing, and some of our PCPs, our primary care physicians, are also providing PCR testing. And our objective is to test all identified symptomatic individuals and their contacts. As some of us, some were talking even before we got started this morning, we also need to keep in mind that testing and the associated PPE capacity is going to be stretched in the future. As construction and businesses open up and their workforce returns from Garfield and Eagle counties, as professional and service offices open and our population starts to spend more time outside and potentially down valley. Ultimately, as wedding, events, tourism, and lodging opens, visitors might come in from endemic areas. And as schools open, both parents and kids will face increased exposure. So these are all going to have an impact on our ability and how many tests we need to be able to do on a daily or monthly basis. There really hasn't been much guidance, for communities in terms of per capita testing capability or capacity. Yesterday, at the federal level, they announced that we got to have at least 2%, be able to test 2% of your population per month. And, I think that's a very, very low number compared to what we're going to need to be able to do going forward. We've been able to stretch our capacity a bit by using private labs. The state lab says they're going to have a better turnaround. We started testing on Friday, and right now we have 18 pending and no results back from the lab yet. So it would be great if we could move to a point where we could do testing within hours, but we're not there yet. We're going to have to continue to rely on private labs, at least for now. Next slide. So this is just a quick breakdown of occupations as reported in census data. We're going to be drilling down on this in terms of our monitoring going forward. So for example, in the construction industry, it shows about 6% of Pitkin County's population reported being in the construction occupation. That doesn't take into account all the people that live in Garfield and Eagle County and come up to Pitkin County. So we'll be having to look at monitoring programs that will know the number of people here, but we're going to also have to look at and cooperate with Garfield County and Eagle County on monitoring that labor force moving back and forth as well. Next slide. So epidemiologists use a model that, and this is just a standard model. It's called a compartment model that uses differential equations to mathematically model infectious disease outbreaks. And they're pretty idealized. You might have seen these from some of the state reporting. If you look at the blue line that starts up in the top left corner, that compartment is our susceptible population. And it declines at a typical epidemic as infections and people who are exposed end up as more infections, and the red line then increases and goes up into the top right area. And those are people who are now immune or die or otherwise leave the population. So unfortunately, our model for Pitkin County looks quite a bit different. Go ahead to the next slide. If you remember back to what was going on at the end of February, beginning of March, which seems like a lifetime ago rather than just 2 months, on March 8th, we received our notice of our first case. Progressive public health orders, March 13th, 18th, and 23rd recommended social distancing, closing ski areas, schools, restaurants, businesses, and advised residents to stay home. And it also advised visitors to leave town and go shelter in place at their home. I think John mentioned before we started that the population of Aspen and Pitkin County can actually go up to 50,000, when we're full, completely full. I used a smaller number, it doesn't really matter the number, but our population dropped down to our resident population, which is about 18,000. So this model reflects that drop in susceptibles, not due to infection and recovery or death, but to actually leaving town. And with them went possibly exposed and infectious individuals in addition to susceptibles. So the takeaway from the graph or this model is that a large segment of our population remains susceptible. And I think this is consistent with state data and even national data. As many infections as there's been in certain areas, there's still a large percentage of our population that is susceptible, which favors kind of a conservative approach going forward. Next slide. What we don't know, and what we'd really like to know, is the absolute number of cases that we've experienced here in Pitkin County. We don't know that because there's been a lack of PCR testing to confirm infections, which is a whole different story that starts at CDC and works its way down. The guidance for symptomatic patients was to stay home and recover at home if possible because of those testing limitations and the lack of antiviral treatment anyway, unless they were very sick. And protective PPE gear was in short supply. So as you can imagine, with surges being experienced in areas like New York City, which is close to my heart because I have a son and his wife who are hunkered down in an apartment there. Pitkin County is not at the head of the supply chain when it comes to test kits and PPE. So go on to the next slide. We have to look at data that we do know. We don't know the total number of tests as confirmed by PCR. We do know the number of Aspen Valley Hospital patients tested. We know the positivity rates of those tested. We know the number of patients who've been intubated and transferred. So between March 9th and April 24th, 37 patients at AVH, and this is data as of Friday. Those numbers have gone up since then, but as of Friday, 13 were positive, 22 were negative, and 2 were pending. So you have to keep in mind that those 37 patients had influenza-like illness. They were not a random sampling of our community, but you can look at the positivity rate there of people who reported with symptoms. We also tested 6 healthcare workers at the hospital. 2 were positive, 4 were negative. And of the 25 admissions, 22 were discharged, 2 were intubated and transferred. One's at the time on Friday, one was still in the PCU. As of today, there are none. There were no deaths at AVH, 2 deaths in our community, sadly, and 2 additional intubated and transferred from the ED. So from hospital admissions, that's one of the hard numbers we have. We can kind of look at it and inferring what the cases are in Pitkin County. If you look at Colorado data, and this was as of Friday, 2,237 people were hospitalized, or 20% of cases required hospitalization. Just using that number, that would say we'd had about 135 cases in Colorado, in Pitkin County. The problem is that some cases requiring hospitalization left Pitkin County. We know that early on when the big group all of the visitors left. We did learn, sadly, that one case of a gentleman that returned to Australia and reported being in Aspen at the time of the reported cases did pass away. So we actually have lost to follow up a lot of those people that were here. And if you think about those people, those were the people that were at the belly up. They were at the, at after après ski parties. They were in ski school. There was, they were the ones that had a lot of contact and then they left town. So our denominator in number of cases is probably much higher. If we look at international data, hospitalizations have been reported as low as 4%. And if we apply that to our hospital admissions, that would mean our cases are closer to 700. And you may be seeing in the news and in literature now that Los Angeles and Santa Clara, California, have done some serosurveys, and New York as well. But in California, both of them had fairly similar numbers, that about 2.8% of their population were previously exposed or have detectable antibodies using their test. And that would equate to about 504 cases in our county. So we have to be cautious a little bit, because the virus doesn't spread homogeneously. It spreads differently in an area like New York City or San Francisco or Silicon Valley versus a rural county like Pitkin County. It spreads in dense urban areas differently. And their studies may also be a bit flawed, depending on the tests they use, whether it had false positives. In Santa Clara, for example, they used Facebook to recruit patients or participants. So people that thought they might have it or wanted to know whether they have it signed up. So it may not have been exactly a randomized sampling of their population. But for epi purposes, I think we can use a range of somewhere of 500 to 700 cases being here in Pitkin County. Next slide. There we go. Which we looked at previously. So even absent an exact count, we are confident that based on hospitalization rates, that we were successful in flattening the curve, but this success means our susceptible compartment is still the majority of our population. Again, whether we use 500, 700, or even 1,000 cases, you subtract that from 18,000, that means that the majority of our population is still susceptible, which means that our physicians will still treat each case of influenza-like illness as if it was COVID-19 until proven otherwise. Our residents should continue to practice hand washing, covering their face in public, social distancing, staying at home when they're sick, and getting tested immediately if they have symptoms. And our public health approach should continue to be conservative, data-driven, protective of public health, and planning for capacity to handle any surge in cases. You know, the fourth criteria is that we need to actively isolate and quarantine contacts. And we're ramping up our army of investigators and contact tracers by currently focusing on training and streamlining our processes for efficient follow-up and of isolation and quarantine individuals. Just like the hospital continues to prepare for a surge in cases, public health is building up its infrastructure as well. And I think this timing that we've put in place now to extend the public health order until May 8th is going to be important timing to allow for that infrastructure to be built up. Finally, the fifth criteria is maintaining communication to the public and employers of the importance of social distancing and reporting all symptomatic individuals for testing, and putting indirect and direct enforcement in place, which is being discussed at all levels. And finally, we should recognize the continuing need to protect our aged population with those with underlying medical conditions, our populations most at risk. If you could see this slide, you would see a graph of the population age breakdown for Pitkin County. 41% of our population is 50 and over. 26% is 60 and over. So what's the risk to those groups looking at statewide data? And if you could see this graph, you would see that 50% of cases in Colorado are 50 and over, but 95.4% of deaths in Colorado are in the 50 and over age group. That's an important number, I think. So you can see from this that 95%, if you add up the deaths in Colorado in the 50 and over age groups, are happening in those groups. 78% are in the 70 and over age groups. So these are the numbers we need to take to heart to make sure that as we open segments, we protect those age groups as much as possible with appropriate guidance. Protocols are in place, and our public challenge is to continue mitigation strategies, even while people are moving more freely about and working. The healthcare system strategy, our challenge is to continue to match capacity with need, and the public health challenge is the box it in strategy. So we are looking at data in our population through our emotional tracker survey as to how they're feeling about all of these hand washing, social distancing, staying at home type activities. And they're all rated somewhat or very easy by the majority, except disinfecting surfaces. And that's basically because they can't find the supplies on the shelves in the grocery stores because of panic buying, but the supply chain does seem to be catching up. So one of the things we'd like to add to this survey now going forward is some questions about whether we're going too fast or too slow, so that you get immediate some better feedback on a weekly basis of, as we start ratcheting things up, you know, how the community's feeling about those activities. Next slide. We do know that the current plan is sound, but also realize the cost of current suppression strategies are high, both in terms of economic and personal hardship. So we need to find a way to live with COVID-19 for likely some extended period of time, since antiviral therapies are not perfected yet, and we don't have a vaccine yet. And that vaccine development, it has to be developed, safety tested, manufactured, and distributed worldwide. Until then, we have to make decisions locally about the pace and best approach to reopening certain businesses and activities to protect our community's overall well-being. Next slide. Just two more quick things. I want to kind of give you a case for gradual easing that kind of relates to some of the consulting work that I do now with small businesses. There's be a tremendous time, financial, and emotional cost to restarting a business, a school, or organization. If you think about a restaurant owner, they will need to rehire laid off workers, invest in restocking perishable inventory, invest in advertising to open up and get back to full capacity, and then they're told they have to shut down again. They may not have the resources to do that more than once or twice. The pain of waiting a bit longer to restart may be less than the start, stop, restart type scenario. We will have to make it clear to them that the risk of reopening now, that there is risk of reopening now, and that if cases surge beyond a certain point, further suppression might be needed. But I think that's important for us to keep in mind, that this is going to be difficult for people, not just, even though they're anxious to reopen, we want to make sure the timing is right. Next slide. So this is the last one here. You know, we've survived other viruses with higher R-naughts, with higher case fatality ratios, like polio and smallpox, and the 1918 influenza pandemic. The shortest path to reducing our susceptible population for this virus may be an effective vaccine that confers immunity. But until then, the most logical path may be to carefully and slowly allow our population to move about and return to work, accompanied by monitoring, collecting data, testing, isolating and quarantining, and protecting our most vulnerable.
Thank you again for joining us for today's community presentation on the epidemiology modeling that's happening in our community. Just a couple more things to remind you in order to stay in the loop. As always, the Aspen to Parachute COVID hotline is active. They have changed their hours to 8 a.m. to 5 p.m., and that number is 970-429-6186. You can also visit the pitkincounty.com/COVID website and also the Pitkin Public Health Facebook page. We post daily English and Spanish recaps and numbers and updates for each day that we have information coming in, and they're also available on that website. So again, thank you for spending time for us today. We will be back with you next week. Look at those channels for that date and the time for the next community meeting, and everyone be well.